Yo, what's up guys? Welcome back to the nursing channel. Alright, so this video is in response to one of my subscribers. Her name is Linda Trin. And I told her I would make this video days ago and I never was able to get to it because I've been so busy with life, work, trying to keep my social life intact, hanging out with some friends, going hiking and working out and all that good stuff. But anyways, I'm finally getting to making her video right now, and I'm gonna answer her question. And her question is, how can you document effectively as a case manager so that you don't get into any legal issues? In other words, how do you CYA as a nurse case manager? And CYA, if you don't know what that stands for, is cover your ass. Okay, how do you protect yourself? And so the most effective way you can protect yourself as a nurse case manager is through your documentation. Now, she gave me a specific scenario. So what if as a nurse case manager, discharge planner, what if you're in a situation where you're talking to the patient and the patient's family, and you know that the patient isn't able to care for themselves at home, but the family says that they have caregivers or that they're going to take care of the patient, and you know that that's probably a bunch of baloney and that they're not really going to care for the patient, and they probably don't have money to pay for caregivers. And so you as a case manager have to make sure that you document appropriately, because that's what is going to cover your behind, okay? So how do you do this? First, you have to recognize, is the patient alert and oriented ×4? Are they able to make medical decisions on their own? Okay? Are they able to provide consent? Okay? If they are, then all you have to do is talk with the patient, tell them, this is what we're recommending, spoke with the medical team, with the doctor and the physical therapist, and they're recommending that you be discharged to a skilled nursing facility where you have 24-hour assistance, around-the-clock care, okay? We're recommending that you don't go home yet because you still need to work with physical therapy and you still need care. And if the patient says, no, I don't want to go there, blah, 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 I don't think it's a good place, then just document the response, let the medical team know what the patient said, and make sure that you document that the patient declined what you were recommending and what the doctor was recommending and what the physical therapist was recommending, okay? Because at the end of the day, the patient can refuse treatment. That's one of their rights. Even though what you're recommending is going to be beneficial for them and it's going to help them get better, and it's going to be safe and it's an effective discharge plan, the patient can still refuse and decline what you're recommending, because as a patient, you have the right to refuse treatment, okay? So just make sure you document that. Now, what if you're in a scenario where the patient is confused, is unable to give consent, and can't make decisions for their own medical treatment? So you're not going to, in this situation, you're not going to document the patient's response. You're going to look for the durable power of attorney. Who is responsible for the patient? Is it a family member? Is it the patient's spouse? Okay? You have to look for this. Or is the patient with the conservator? So you have to have this conversation with the person who's legally responsible for the patient. Okay? And then you talk with that individual, and that individual can also decline whatever you're recommending, okay? But make sure that you document, I spoke with so-and-so at this time on this day, and I told him that the doctor and the physical therapist are recommending this type of treatment for the patient. However, this individual, whoever it is, declined our recommendations and the safe discharge plan that we had proposed, okay? And so that type of documentation will cover you. And chances are when patients or the patient's guardian refuse the recommended discharge plan, chances are they're gonna, they're gonna come back to the ED if they don't have proper treatment after the hospital. They're gonna come back to the hospital, and you're gonna see them again. But you're not gonna get into any legal problems because your documentation is what's gonna protect you. Okay? If you go to court, they're gonna look at all the documentation, what was said, what was done, and they're gonna see your note and say, okay, this case manager was recommending this. He had this conversation with you. This was a safe discharge plan. However, you refused the discharge plan that was proposed to you. So now, you did your part as a case manager. Now it's on them. So anyways, I hope this helped you guys. This video helped you guys out. If you want to ask any other questions regarding case management, discharge planning, or utilization review, feel free to ask me those questions in the comment section below. Please don't forget to subscribe, because I really, I'm really trying to grow this channel and spread helpful advice for people that want to get into the case management field. Anyways, and I appreciate your guys' support. So anyways, feel free to ask me any type of question, any nursing question. If I know the answer, I'll gladly respond to you in a video response or in a message. So don't hesitate. Anyways, I love you guys. Take care, and I'll see you guys next time.